with the examination, make sure to properly wash your hands first. Good afternoon, sir. I am Rachel Dendaka, student doctor. May I know your name and age?
My name is Mark Christian Villaseran and I'm 25 years old.
Okay, so for today, I'll be doing the examination of your mouth, throat, and neck. Do you notice any problems with those parts?
No po.
So we'll begin the examination. You can see here that the lips is quite pink and moist. There is no scaliness or cracks, no lumps also. Can you now please open your mouth? For the oral cavity, there are no ulcers, no nodules. It is pink and moist. You can also note here that the teeth are white, in good shape, complete. It is not loose. The gums are also pink and nice. There are no swellings or ulcerations. You can also see here that the ventral surface of the tongue is pink and shiny. You can see the veins. Can you please take out your tongue? So we can see here that it is in the midline. That means the cranial nerve 12 is intact. Let us now check for the roof of the mouth. Please open again. So I can see here the hard palate is white and has rugae. The soft palate is pink as well as the uvula.
So now next part is palpation of mouth. I am going to do the palpation of mouth. First I will check the tongue part. So can you please show me your tongue please? I will just palpate the tongue for any abnormalities. So next part is I will just check the submucular gland, submucular duct and their function by manual palpation of the submucular gland. Can you just open the mouth? Okay, so next part is I will just gonna check about the cranial number 7 and 12. So cranial 7 is the facial nerve and it has the both motor and the sensory function. For the sensory part, I will just check about the how to smile and the cheeks. So can you please close your eyes tightly. Can you try to open it? Okay. Now I will check the sensory part of the tongue. So I will just use the cotton buds and each cotton has the different taste. So can you please taste this one? Can you please? What's that sweet? Okay. So now I will check the other. Salt. Okay. Now next. It's sour. Okay. So we are done with the cranial number 7. Now I will check the cranial number 12 for the hypoglossal. Can you just portray your tongue? Can you move it to the right? Can you move it to the right? Yeah. Okay. So now I will just tell the 3 words. You have to follow me. Light, tight, and dynamite.
Light, tight, and dynamite.
Okay. So cranial number 12 is intact. Thank you.
This is a video demonstration of physical examination of the pharynx. Firstly, we'll begin with the examination of the vagus nerve, which is the cranial nerve 10. For this, we ask the patient to open his or her mouth and tell her to make a sound. Can you please open your mouth and say ah? And in the next part, we'll begin with the inspection of the throat. For this, we'll be using tongue blade in order to check the inner portion of the mouth. So you can see that the uvula is in midline, and you can see that there is no inflammation in the tonsils. You can see the anterior and the posterior pillar are also normal as well, and you can see that you can also observe that the soft palate. And next part, we'll move on to the palpation of the pharynx. For this, you have to palpate for the pharynx and look for any sort of inflammation of the lymph nodes. So in this patient, the lymph nodes are not inflamed. Thank you.
Now I am going to do the examination of the lymph nodes. For that I will be inspecting and palpating the lymph nodes. If you have any pain or discomfort, just inform me. Preauricular lymph nodes, postauricular lymph nodes, occipital lymph nodes, tonsillar lymph nodes, submandibular lymph nodes, submental lymph nodes, then the superficial cervical lymph nodes, posterior cervical lymph nodes, deep cervical lymph nodes, and the supraclavicular lymph nodes. There is no enlargement noted. Next, I am going to examine the thyroid gland and the trachea. Now I am doing the inspection of the trachea for any deviation, and now I am going to do the palpation. There is no deviation or any swelling. For watching the upward movement of the thyroid gland, ask the patient to sip some water and observe the swallowing. Thyroid cartilage, cricoid cartilage and the thyroid gland all rise and back to normal. Then I am going to palpate for any deviation of the trachea from the midline. There was no deviation observed. Then I am going to auscultate for hearing the breath sounds from the trachea. There was no abnormal sounds noted. And our examination for the trachea and thyroid is completed. There was no deformities. Thank you.
Good morning, sir. So for today, I will be assessing your thyroid gland using your microscope. So for the first part, may I ask you to tilt your head back? Okay po. So for the next part, I will be asking you to take a sip of this water, and when you follow it, please tilt your head back. So for the next